Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Annette Kiser, Chief Compliance Officer with Teleios Collaborative Network. Thank you so much for joining us today, Annette.
Thank you for having me today, Millicent. I always welcome an opportunity to talk about compliance.
Oh, well, and I'm so grateful that you're with us, and just to help the community feel like they can get to know you a little bit better and learn more about why we're talking with you. Could you tell us a little about yourself and your background?
Sure, I'd be glad to. I'm a registered nurse, and I spent some time working in a hospital and then had an opportunity to volunteer as a hospice nurse. And I found it rewarding to be able to bring comfort to patients and families at that time in their lives, and decided that's what I wanted to do. And so within about a year, I started working in a local nonprofit hospice, and that's what I've done for the last 38 years, working in hospice and serious illness care. And those years have been in the nonprofit world, like Four Seasons is nonprofit. And I found my love. And because of working in a really small hospice, I had to also be involved in compliance and quality and all facets of the organization, and found that I was one of those geeks that like to get into the regulations and see what the fine print says. And spent about 20 years, though, in the field providing patient care, knowing what good care is supposed to look like. And then I moved into compliance full time. I've been with Teleios Collaborative Network for almost 8 years now. And I partner with about 20 hospices across the country and provide coaching, technical assistance, and education around a wide range of laws and regulations.
You know, one of the things I'm so grateful that you have been able to connect with me on over these years is about compliance. I remember years ago, whenever I first started as a CEO, we were developing, like we do for all of our entire organization, but a learning plan. How do we help make sure that every individual who's employed with our organization is in the mode of learning what they need to learn to benefit their own professional development, their role in their team, and ultimately our organization's mission, which is co-creating the care experience, making sure that the community has access to the most trusted care possible. And so that first year that you and I worked together, I learned that certainly compliance awareness before existed, but when you think about all that compliance entails, you just have such a great way of connecting it with our why. And when I think about, and I'm about to ask you a question, but when I think about compliance, I think about the fact of ensuring that whomever needs access to care has quality access to care, and that we can document that quality care that we provide. So, before we delve a little bit deeper, I would love if you would be willing to share what compliance means in terms of care provision. Why that should matter to our community would also be of benefit.
Sure, I'd be glad to. And compliance, in simplest terms, is doing the right things always, no matter what. And it's knowing and following the rules and regulations, but it means we also have to educate our staff. We have to be willing to monitor ourselves, to continually seek to improve in all the different areas that we impact. And compliance has to be more than just, okay, we're following the rules, that's enough. We have to have an organization like Four Seasons that has a culture of compliance woven throughout the organization. You even have a committee of your board that looks at quality and compliance on a regular basis. When you and I meet regularly, you're always saying, what else do we need to be concerned about? Are we paying attention to the things we need to pay attention to? And so compliance is interwoven, and it's a part of what an organization that's providing compliant and quality care should be doing on a day-to-day basis. It's not just when the auditors or surveyors are coming. It should be what's expected and what happens, and it should be a natural part of what takes place.
I love what you just said, compliant and quality. And when I think about quality care, that means that it is co-created, it's what's appropriate and what the patient or the loved one needs and desires, but it's also compliant care. It's making sure that we are providing that most trusted care. And you certainly are a tremendous resource. And I appreciate what you shared. Yes, our board of community members come together to say, like, hey, in the area of quality and compliance, how can we help raise the awareness that Four Seasons is completely committed to providing the best care and documenting it, or in your words, doing the right thing always. And in fact, we have a value around integrity at Four Seasons, and the definition's really closely connected there. That makes me think about excellent education and support that Teleios Collaborative Network provides. And some months ago, Chris Como, the CEO of Teleios Collaborative Network, was able to join our podcast and share with our community about who Teleios is and why that could be applicable or informative for the community. And what we looked at is, our local organization of Four Seasons serves 14 counties. And we provide services of care navigation and personal home care, as well as palliative and hospice, and then grief support. We have home stores and a foundation, and the list can go on. But we offer all of these services because our community deserves the most trusted care. And so when I think about our commitment to co-creating the most trusted care as an organization, I would love our organization who might listen, as well as our community externally who may listen, to know, so how do we stay aware and informed, not only about within our internal, but external? And so certainly we have many of us who do a lot of national collaborative work and research, but being a part of Teleios is a substantial benefit. And we have education and support at our fingertips. So could you talk a little bit about the great benefits that TCN offers and how the community could even benefit from this?
Thank you, Millicent. And we do enjoy partnering with Four Seasons. It is a tough job to stay abreast of all the changes and regulations, the guidance that's coming out. Just when we think we may have figured something out, somebody comes along and changes it, whether they change it with the regulation or they change their interpretation or application of it. There are a lot of things to keep up with. As you said, there are great resources nationally, locally, state level. But it's hard for an organization doing day to day to keep up with all those different aspects. And so we at Teleios do that. I have two excellent compliance specialists on my team who help me monitor the many channels of communication. And then, of course, all of our leaders within Teleios are paying attention. But we're reviewing things from CMS, which is the Centers for Medicare and Medicaid Services. That's a very important organization to our community because they're the ones who set the regulations. They're the ones who monitor have the surveys completed to come in and assess how a hospice organization's doing. But then we have the Office of Inspector General. We have Congress telling us how to do things. OSHA, Department of Labor, many aspects. It's not just about patient care and just those regulations, because if we're not paying attention to the regulations that impact the organization, our employees, and all that we do, then we're going to have compliance breakdown somewhere, and then that can actually impact the patient care that we provide. And so our community can be pleased that in Western North Carolina, we have an organization that pays attention to all aspects of compliance. And so we're subscribing to many emails, newsletters, blogs. We're reading what attorneys say because they'll take something and pick it apart, and they have a different perspective than what we do. And so we try to pay attention to what they're saying, what other consultants are saying. My team right now, as I'm talking to you, are divvied out into different areas, attending webinars and whatnot so that we can stay abreast of what's happening. We often get into meetings and we can hear someone else's interpretation or someone else's experience. And that's one of the beauties of the network, is because we're working with 20 organizations across the country, we can hear what happens to one and how things are viewed. And it can help us go, oh, let's take a look at that within our organization. Maybe that's an area where we can enhance what we're already doing well. But we have regular meetings with organizations, and the Four Seasons team attends those and hears what's going on in the compliance and the quality world. You are constantly reviewing your data, and we're trying to do that with looking at our consumer satisfaction scores, seeing what the community is saying about the care that Four Seasons provides, and finding ways to improve that. And so we're working in many different areas of the organizations. Four Seasons wants their leaders all the way down to, back office staff, those who are doing billing and accounts payable. We want everyone to be compliant and providing quality care. And you mentioned, Millicent, different service lines. It's a matter of looking at home care, looking at palliative care, looking at care navigation, looking at hospice, and even bereavement. There are aspects of compliance and quality that go into the bereavement services that the organization provides. And so we're just trying to keep our feelers out and keep connected to the different parts of the organization so that we can make sure we're doing things that we can to support you, helping bring that education and the information to you so that you can continue to educate your team.
One of the things that I'm really thankful for is what you just shared. And it's a lot of information to make sure that we stay compliant, but it's the right thing to do. Because if we're going to co-create the most trusted care, we have to be dedicated to doing it better and making sure that we're aware of what we need to be aware of, right? So we can be compliant. One of the things that we created at Four Seasons some years ago that you've helped us improve upon is a compliance matrix, if you will. So we could see, all right, among all of the areas that we could focus in or need to focus in, what's priority and how are we doing? And that way, if there's something that we need to prioritize, that's at the top of our list. And in fact, when I think about the community, for those that we serve, it's a really excellent way for us to be able to make sure that we're staying in connection to assure that we're meeting their needs. And so whether that's through a process of feedback with the case manager, social worker, and the like, asking how well the services are, by them participating in a survey, whatever approach it may be, we genuinely care about what the community experiences and needs. And so we're able to take from the feedback to say, okay, where are we doing well? And where do we have opportunity for improvement? And that's another way that we say that we are truly committed to providing that high quality, most compliant care possible. In other words, trusted care. And so when you think, Annette, of Four Seasons, could you provide just a couple of examples to the community of, here are some ways that Four Seasons looks beyond what's just expected, but goes further to ensure the most trusted care possible is provided?
Well, I can, Millicent, and I'm proud to work with Four Seasons because of the attention that they give to quality and compliance. And you mentioned going further, and that's so important. A lot of organizations sadly choose to do the minimum, and they do what they have to do to get by. And I encourage the community to educate themselves on what quality, compliant hospice care looks like, and we can provide some resources for that. But Four Seasons every day holds itself to a higher standard. Compliance, as I said earlier, has to be interwoven from the top down. It goes hand in hand to set that higher standard. And Four Seasons has a dedicated quality and compliance team of professionals that is continually partnering with the administrative staff, with the clinical staff, with the leaders to assess that care that's being provided, to ensure compliance with the regulations and standards, to educate staff. As you've mentioned a couple times, documentation is important. I know that from the community, if a patient or family has a need to have their record, they want to know that the care that was provided is going to be there. But we also have a lot of regulators, auditors, and surveyors. We want to make sure that we can prove that we actually gave good care. It's not enough to speak it. We have to document it. And Four Seasons has set that standard high by continually focusing on process improvement, monitoring outcomes in so many areas. I think the community would be amazed at the number of metrics that Four Seasons monitors to make sure that you are meeting not only the standards and the regulations set by others, but your own internal standards, which are higher than those that are required. Four Seasons has gone even higher by choosing to have surveys every 3 years by the Joint Commission, which is a national accrediting organization, and that's not required. You are required to have surveys by the Medicare surveyors every 3 years, but you're not required to have an accrediting organization. That's something that Four Seasons voluntarily does and actually has to pay to have happen. But it's a way for you to have additional standards beyond those required by Medicare and the state, to have someone else come in and look to make sure that you have set the bar high and that you are following that. Not that any organization is perfect, but you make sure to take an opportunity to see where you may fall a little lower than what your bar may be, and you're continually working to improve that. Process improvement, performance improvement is a continual process, and it's something that Four Seasons does well. The Western North Carolina community needs to know what quality and compliant hospice care looks like, as I said, and I can assure them that compliance and quality are interwoven through Four Seasons in care navigation, home care, palliative care, hospice care, bereavement care, and it's there because of the people that you have committed to monitoring, but then everyone in the organization who wants to co-create that care experience and make sure that patients and families and all others in the community, our referral partners in hospitals and community facilities and hospitals, physicians' offices, are all able to see that we are a high-quality, compliant hospice. And I think the community would be pleased to know all that Four Seasons is doing to make sure that it is a compliant organization.
Mm. Thank you for sharing that. Out of all of the excellent information that you just shared, I hope what the community hears is that we care for each of you. And when we are serving someone within our care, it matters to us about the experience of one's care. And so for those listening, perhaps we're serving a loved one presently, or perhaps we will in the future. Just know that you can always reach out to us. And we want you indeed to reach out and share what's on your mind, share how we can provide even better care. And we offer continued training and continued support for our staff, for our volunteers working with Teleios Collaborative Network, and also for our people in the community, whether it might be a family member who says, I don't feel really confident in this space, but I need to know. We offer support and training real time. So anytime you have a need, please let us know. And at the end of the day, I genuinely hope that our community will go away from this time saying, you know what? If I'm ever in need, I'm going to call Four Seasons because I already feel how much they care. And we've been caring since 1979 and will continue for many more years. So Annette, thank you for your partnership and for your expertise. Thank you for helping our organization fulfill our mission to our community, our commitment to our community of co-creating the best care. Thank you for joining us today.
Thank you for having me, Millicent. Thank you for partnering with Teleios Collaborative Network to provide services to you as you continue to provide compliant quality care.
Well, we love our community. We thank you for each of you who are listening, and please don't hesitate to reach out. For more information about our services, please visit us at fourseasonscare.org.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.